Every single person has a story, and it's usually a pretty complicated mix of experiences, feelings, and challenges. But how does a clinician take that intricate human story and turn it into a clear, safe, and effective medical plan? Well, that's exactly what we're going to get into. We'll see how a really structured approach can bring some serious clarity to a very complex situation.
So here's the game plan. We're going to start with a patient's really high-stakes dilemma. Then I'll introduce you to the clinical framework they use to solve it. It's called the SOAP note. We'll break down each part, subjective, objective, assessment, and plan, to see exactly how a diagnosis gets made and how a treatment strategy is actually born.
All right, let's meet our patient. She's looking for help, but her situation, well, it's anything but simple. And this is where the real art and science of clinical problem-solving really begins.
It all starts with this one sentence. And it seems simple, right? But it's so powerful. This isn't just about having a bad trip. It's a textbook sign of something called anhedonia, the inability to feel pleasure. It's a core symptom of depression, and for her, this was the red flag that made her realize she needed to seek help.
Okay, so here's the absolute heart of the problem. We have a 45-year-old woman. She's in remission from breast cancer, which is fantastic, but she's also struggling with moderate depression and really needs treatment. The huge issue? A go-to antidepressant, Wellbutrin, has a major negative interaction with her cancer medication, tamoxifen. It could actually make the tamoxifen less effective. This is a classic medical crossroads where there are no easy answers.
So, how on earth does a clinician navigate a challenge like this? Well, they don't just wing it. They use a clear, systematic blueprint to guide their thinking, and it's called a SOAP note.
Now, I know what you're thinking. This looks like boring paperwork. But a SOAP note is so much more than that. It's a critical thinking tool. It's how you organize a flood of information, separate what the patient feels from what you can actually observe, and build this logical path from a person's story to a solid plan of action. Think of it like a detective's investigation. Seriously. The subjective part, that's the witness testimony. It's the patient's story in their own words. The objective part is the forensic evidence, all the stuff the clinician can see and measure. The assessment, that's the detective's theory of the case, the diagnosis. And the plan, well, that's the action plan. What are we going to do about it? Let's see how this whole thing gets built, step by step.
So, we always start with S for subjective. This is where the clinician just listens. Their job is to capture and document the patient's experience from her point of view. It's literally the foundation for everything that follows. So here's what she tells us. She rates her depression a 5 out of 10, and it started after a breakup a few months ago. She feels this constant apathy, that inability to enjoy things we talked about. She's got a ton of stress from work, feels socially isolated, especially since she recently lost her best friend. And this is key. She's never been on any psychiatric medication before. This paints a really detailed picture of her inner world and what her life is like right now.
Okay, next up is O for objective. This is where we shift gears. We move away from the patient's internal experience and focus on the clinician's external, verifiable observations. This is all about the data you can see and measure.
Now, this is a really cool and important distinction in psychiatry. You've got mood versus affect. Mood is what the patient reports feeling. In her case, depressed, 5 out of 10. Affect, on the other hand, is what the clinician observes in her facial expression and body language. And for her, the affect is full, appropriate, and congruent. That's just clinical speak for saying her outward expression perfectly matches the sad mood she's describing. It lines up, and that's a key piece of objective data.
The rest of the mental status exam adds even more to this picture. She's well-groomed, cooperative, her speech is clear, her thinking is logical, and she has really good insight. She knows she's struggling. And this perfectly illustrates something so common with depression. A person can be absolutely falling apart on the inside while looking totally composed and functional on the outside.
And now we get to A, the assessment. This is the synthesis. It's where the clinician takes that subjective story and all the objective evidence and starts connecting the dots to form a professional judgment.
So, with everything we've heard from her story and seen in the clinical exam, how does it all fit together? What's the diagnostic conclusion here?
This table lays out the thinking process beautifully. Her anhedonia, not enjoying that vacation, and her social withdrawal, they line up perfectly with the criteria for major depressive disorder. Her long-running social anxiety, that feeling of having to power through social events, plus the work stress,
That points to generalized anxiety disorder. And finally, based on her own suspicions and a family history, a provisional diagnosis of ADHD is put on the table to look into later.
And that brings us to the final and honestly the most critical step, P for plan. This is the roadmap. It's a concrete, actionable strategy that's designed for this one specific patient.
So check out the plan. It prioritizes her physical health and safety above everything else. Right now, the #1 focus is to continue her life-saving tamoxifen treatment without any interference. Once she finishes her course in March of 2026, there's going to be a bit of a waiting period to see what her mood is like without that variable. And only then, in the summer of 2026, will they even start the conversation about an antidepressant again.
So, the big takeaway is this. The plan is to wait. By putting antidepressant therapy on the back burner, the clinician makes sure that the tamoxifen can do its job at 100% efficacy. This is a truly patient-centered decision. It carefully weighs all the risks and all the benefits, and it shows that sometimes the best immediate action is a well-reasoned, intentional pause.
This whole case just shows how a structured method like SOAP can bring order to a really chaotic and high-stakes situation. It kind of makes you wonder, doesn't it? In any part of our lives where things feel complicated and overwhelming, just how vital is it to have a clear, structured plan to find the absolute best path forward?